like to start the program, and I invite us all to prayer. Let us pray. Almighty God, we come before your presence this morning. We thank you very much for this opportunity that you've given us to be able to assemble here for this worthy cause. My Father, as we go about the meeting, we pray that you bless us, help us to understand whatever will be shared here, and as we go out, may we be able to share it well out there. In the name of Jesus Christ, we pray and believe. Amen. So, I invite us all to stand for the national anthem. Standing for the East African anthem. Thank you. We may be seated. I invite Dr. Karanja, the Director of Mental Health.
Good morning, ladies and gentlemen, distinguished guests, all protocol observed. Good morning. Welcome to our event today. Today we are having two parallel things running. One is we are launching the National Clinical Guidelines on Management of Common Mental Disorders. And secondly, we are also observing World Suicide Prevention Day. And as I invite the Director of Family Health to speak, as we await our chief guest, the Director General, I also want to encourage you all to go to X and tweet about, or I don't know whether it's called tweet anymore, and publicize this event under the hashtag World Suicide Prevention Day and hashtag Start the Conversation. So welcome Dr. Bashir for the opening remarks.
Good morning, everybody. Distinguished guests, government officials from the national government and from the county, our partners, CDC, PEPFAR, Johnson & Johnson, all protocols observed. I'm happy today to be here to start the conversation. As alluded to by Dr. Karanja, this is a long journey we've walked together with our partners. We know very well that as a nation, we are very behind in terms of our commitment to providing mental health services as per the Constitution. But a journey of 1,000 miles starts with one step. Today we are here commemorating the World Suicide Prevention Day and giving a gift to this nation for better care. The Ministry of Health is dedicated to enhancing the availability and efficacy of mental health services across the country. This commitment is reflected in our strategic approach to improving access to quality mental health care, encompassing prevention, treatment, and rehab services. In this regard, the Ministry adopted WHO Mental Health Gap Action Program and developed national clinical guidelines for common mental health conditions as a strategic approach to achieve this goal. The Ministry, in collaboration with various stakeholders, was able to create guidelines that are relevant, comprehensive, and adaptable to the specific needs of our population. These guidelines cover a wide range of essential components, including assessment, diagnosis, treatment, and aftercare. This comprehensive approach ensures that patients receive a holistic and effective treatment plan. Evidence-based assessment and diagnostic procedures help to identify the mental health conditions accurately, while pharmacological treatments and psychosocial interventions offer a range of options for addressing symptoms and improving overall well-being. Aftercare support, including linkages and referrals, is crucial for ensuring continuity of care and preventing relapse. These guidelines will provide a standardized framework for healthcare professionals, thus provide a resource for improving healthcare workers' knowledge and skills in mental health care. By standardizing assessment and diagnostic procedures, the guidelines will help to reduce inconsistencies in treatment and improve patient outcomes. Additionally, they ensure the effective use of pharmacological treatments and provide clear referral pathways for aftercare support. For patients, the guidelines will offer several advantages by ensuring that healthcare professionals are following evidence-based practices. The guidelines will help to enhance the quality of care and improve patient outcomes. Ultimately, this will contribute to a more supportive and inclusive environment for individuals with mental health conditions. So it is my pleasure and honor to welcome all of you to listen to the presentations and to help us and celebrate with us in the launch of these guidelines by our chief guest. The chief guest is on his way. He was concluding another meeting, a Global Fund, and therefore we will continue with our program. Mine was to welcome you and to give you an introduction to the agenda of the day, and therefore I welcome Dr. Mercy Karaja to take us forward. Asante sana.
Thank you, Dr. And we thank you all for your patience and for being here. The next step, as Dr. Bashir has said, we have developed a guideline that is the first of its kind in Kenya that will guide the management of mental health conditions from primary health care to even referral level. And for you to get a grasp of what it is that we'll be launching today, we have prepared a short presentation that will be run here on the screen so that you can familiarize yourself with just snippets of the content of this guideline. So I'm going to ask that we play that clip so that you can appreciate how the guidelines look like. Thank you.
Mental, neurological, and substance use disorders are highly prevalent globally and locally, accounting for a significant burden of disease and disability. This disability, depending on the number of years lived with it, can be devastating to individuals, families, and communities. In Kenya, however, mental health care is relatively inaccessible, inconsistent, and inadequate, with a wide human resource gap. Furthermore, stigma and discrimination associated with mental health problems have barred persons with mental health conditions from seeking help, hence worsening their condition. The Kenya Mental Health Policy aims at ensuring that Kenyans have access to comprehensive, integrated, and high-quality mental health services at all levels of healthcare. Company of mental health systems and of healthcare workers. The development of these guidelines aims to capacity build healthcare workers to provide evidence-based mental health services in Kenya. The guidelines speak to the management of the following common mental disorders: psychotic disorders, depression, bipolar disorder, anxiety disorders, post-traumatic stress disorder, neurocognitive disorders. Common mental disorders in children and adolescents: sleep-wake disorders, suicide and other psychiatric emergencies, and maternal mental illness. There is also a chapter on special considerations for managing specific populations and the recommended psychosocial interventions used in management of common mental disorders. They include steps to be considered to make a diagnosis, assessment, and various examinations to be done in order to arrive at a diagnosis. They also recommend the treatment modalities, emphasizing on holistic management of the patient and referral mechanisms to be employed. The launch of these guidelines coincides with the World Suicide Prevention Day that is observed every 10th of September. The triennial theme for World Suicide Prevention Day for 2024 to 2026 is Changing the Narrative on Suicide. With a call to action, start the conversation. This theme also emphasizes the need to prioritize suicide prevention and mental health in policy making, calling for government action. On this front, the Ministry of Health has taken the lead, having launched these guidelines on the management of common mental disorders. The Ministry of Health therefore calls upon all stakeholders to commit and support the implementation of these guidelines in order to improve access to quality mental health services in Kenya.
Let's appreciate the team behind the work on developing these guidelines. We appreciate the support we receive from all our partners and even the technical expert that was given and provided by the various experts in this room. And as you have seen, we're also observing the World Suicide Prevention Day. And in honor of that and in respect of the persons who have died from suicide, we're going to be observing 1 minute of silence. And I'm going to ask all of us that will be upstanding as we start 1 minute. We observe 1 minute of silence in honor of those people who have left us and died from suicide. Thank you very much. Let me take our seats. Thank you all. And as you are aware, these guidelines, as has been said by our Director of Family Health, they're going to help us improve service provision to persons who suffer from mental health conditions. And from that, we'll also see a reduction in cases of suicide. They'll also help us reduce the stigma that is associated with mental health conditions, since now we'll be able to integrate mental health care in various levels. But people who have had mental health conditions have not always been privileged to have care accessible to them. And because of that, we want to hear from a person who has used the services of psychiatry, from their experience, and also from a caregiver, how it has been for them, the journey of accessing services, the journey of getting treatment, and where they are now. And allow me to welcome with us one of the users of psychiatry services, Mr. Njoroge Judah. Karibu sana Judah. We really appreciate you for accepting to share your story. And please let's welcome him with a round of applause. Yes. And remember, we are talking about starting the conversation, and the conversation cannot start without having the users of the services speak out about their experience so that you can also be able to relate with what they go through. Karibu sana Judah, and thank you for accepting to be with us today.
Good morning. Good morning. Dignified guests, ladies and gentlemen, all protocols observed. I hope you're having a wonderful morning today, yeah? So I like being a little interactive, so you'll allow me just 5 minutes of your time. I'd start with, imagine you going through the worst time in your life, categorized by you as the worst time. And imagine never knowing that I can receive services, or trying to be the first person in your family to go seek help. Imagine knocking on a door and saying, I think I want to see a psychiatrist. Imagine the people in your life. What do their faces look like? Who are you telling that? What is your friend saying about it? And then imagine overcoming that and getting into an office for the very first time. Seeking a service that you don't know what actually you're going to get. And you say, I have been going through A, B, C, and D, and I think I need help. Now, imagine how would you want the person hearing you, responding to you, to talk to you? How would you want them to lead you through the service? Talking about this, my experience started when I was back in campus. And because still stigma and discrimination was something very alive and present, when you go talk to your friend or your family, they're like, nadhani uko sawa, I think you're okay. Then you walk into that room, you find the courage to go to a practitioner. And most of the practitioners are located within public hospitals or public facilities that are general facilities. So you can imagine it's the treatment from the reception to the practitioner that really, really matters. And again, let's go back to that point where you're feeling like you're going through the hardest time in your life. So I'm glad to say that that step, I took a courageous step, and I had a support system over time who I could be able to teach and lean on and be open on my journey and my experience. And because of that, the support that I've had with very supportive practitioners, with steps that at times I wanted to go back, at times I did not want to go back to the facility, but then that support and that reliability of the service is what took me back. Unfortunately, not many of us who are service users get to experience the same. And this is because, again, back to my example, imagine you're going through the worst time. You go to a receptionist at a facility and they tell you, I don't think we offer that service here. Where will you turn to? So I'm really, really happy about the guidelines that we're launching today. And thank you so much to the Ministry of Health, the Division of Mental Health, and all the partners because of the standardization of care and that reliability that will come from the standardization of care. If I'm going to support a fellow person going through a mental health condition, I can tell them what to expect, and I can tell them that there are guidelines in place that practitioners do follow, and you will have an easier time transitioning into receiving the help that you urgently need. And again, there's the question of continuity of care. A question I normally ask myself is, if I travel, will I be able to seek a service in Kenya? Do I have to come back to my practitioner? And this is a thing that stops most of us from moving around. And these guidelines will help us with accessibility. When you get an opportunity somewhere else, you can rely on the fact that there are guidelines in place that will be able to help you and will be able to direct the type of service that you get. And fortunately, my journey did not end with me. I now work for Basic Needs, Basic Rights Kenya, helping people receive services. And this will also help with the guidelines, because whenever we're having a public campaign, I can tell them there are guidelines in place, and this is what you can be able to expect going forward. So thank you so much, and I hope that was clear, and if you have any questions, please, about service usage, you can come to me. Thank you.
Thank you so much, Judah, for sharing your story. It's never easy to say that because of the societal expectations and the stigma and discrimination that is out there for people with mental health conditions, it's never easy for people to share their stories. So let's appreciate him one more time. Thank you so much. He has mentioned that the guidelines will actually improve how care is provided. It will standardize. As you are aware, most of us are Africans in this room, and we know all the practices that go towards addressing mental health conditions in our communities, from cultural practices that are not evidence-based to some other kind of practices that really do not respect the rights of persons who have mental health conditions. And we are changing the narrative here by standardizing the care and giving evidence-based practices to be used by healthcare workers. In addition to these guidelines, we are also launching an e-learning platform for healthcare workers that will complement the guideline. So it is so good to hear that there are caregivers who are already getting the best help for the persons who are in their families and affected by mental health conditions. And at this point, I would want to welcome one of those caregivers, Ms. Nancy Gashoka, to come and give us a story of how it has been taking care of somebody who has suffered from a mental health condition, and maybe here, is there anything they're expecting as caregivers from the launch of this guideline? Let's welcome her with a lot of applause. She's still in the room. Is she in the room? Right, let's try and find her. As we find her again, we will be launching the guidelines, and also we'll be launching the e-learning platform for healthcare workers to understand better how to utilize this guideline. It will be accessible and a self-paced learning approach. We can ask the DJ to once again play the presentation so that it can run as we wait for Ms. Nancy Gashoka. Remember also to go to your social medias with the hashtag
Substance use disorders are highly prevalent globally and locally, accounting for a significant burden of disease and disability. This disability, depending on the number of years lived with it, can be devastating to individuals, families, and communities. In Kenya, however, mental health care is relatively inaccessible, inconsistent, and inadequate, with a wide human resource gap. Furthermore, stigma and discrimination associated with mental health problems have barred persons with mental health conditions from seeking help, hence worsening their condition. The Kenya Mental Health Policy aims at ensuring that Kenyans have access to comprehensive, integrated, and high-quality mental health services at all levels of healthcare through strengthening of mental health systems and capacity development of healthcare workers. The development of these guidelines aims to capacity build healthcare workers to provide evidence-based mental health services in Kenya. The guidelines speak to the management of the following common mental disorders: psychotic disorders, depression, bipolar disorder, anxiety disorders, post-traumatic stress disorder, neurocognitive disorders. Common mental disorders in children and adolescents: sleep-wake disorders, suicide and other psychiatric emergencies, and maternal mental illness. There is also a chapter on special considerations for managing specific populations and the recommended psychosocial interventions used in management of common mental disorders. They include steps to be considered to make a diagnosis, assessment, and various examinations to be done in order to arrive at a diagnosis. They also recommend the treatment modalities, emphasizing on holistic management of the patient and referral mechanisms to be employed. The launch of these guidelines coincides with the World Suicide Prevention Day that is observed every 10th of September. The triennial theme for World Suicide Prevention Day for 2024 to 2026 is Changing the Narrative on Suicide. With a call to action, start the conversation. This theme also emphasizes the need to prioritize suicide prevention and mental health in policy making, calling for government action. On this front, the Ministry of Health has taken the lead, having launched these guidelines on the management of common mental disorders. The Ministry of Health, therefore, calls upon all stakeholders to commit and support the implementation of these guidelines in order to improve access to quality mental health services in Kenya.
Thank you very much. As we wait Ms. Nancy to arrive, I would like to welcome Robert to give a spoken word. Tumkaribishe kwa makofi.
Hello everyone. Hello, how are you? My name is Robert Amandi, and I have a poem that I'd like to present. It was written in 2018 while I was still in campus. I was in class and my then roommate was having an episode, and I was called by one of the neighbors, and they told me like, oh, mwenzako ameonekana akitembea bila nguo. Back then I was studying in Mombasa, and it was my first time to see or to come face to face at hand with how a person with a lived experience and the struggles to find care and the stigma. It's called Silence, and once again, welcome. Silence. Silence like the room that I'm locked up in. Silence like when they mention my name in the streets. Shh. Silence. Amechizi. Amerukwa na akili. He's gone nuts. Nimeenda simu. Silence. I listen to them as they speak. I watch as they walk away. I follow their commands like a dog tied with kennels. Sometimes I'm chained up in my own bed, a prisoner in my birthplace, a foreigner in the same streets that I grew up in, a wanderer in the familiar streets that I was with them. Silence. Amechizi, amerukwa na akili, he's gone nuts, ametolewa kiti. I listen, I watch, I follow as they follow their cultural practices and beliefs that are embroidered in their hearts, tailored in their brains. To them, mental illness is not an illness or a disorder. It's rather an ill, a punishment from the gods, a curse from the ancestors, bahati mbaya kwa familia, and as a result, I'm chained up, locked up, forgotten. Sometimes my female companions are taken advantage of, ripped off their innocence by people who claim to be sane. You see, at times they take us to shackles of spiritual dens where preachers and witch doctors do all manner of madness. To us, sometimes you wonder, who's the mad person in that picture? But such times I'm too traumatized to speak. I feel so afraid and lonely, and according to them, see, in quotes, nimechizi, si nimerukwa na akili. So my hallucinations and illusions take the better part of me. Sometimes nipate nikifanya vitu zangu, sometimes nipate nikisema maneno yangu, sometimes nipate nikirarua makaratasi, because they contain the pages of my life that already lost meaning. They stare at me with amusement. They laugh, turn and slowly walk away. But wait, mister, wait, miss, how did I get here? I may be schizophrenic, I may be psychotic. But such terms sometimes are rare in this continent. And sometimes you wonder which doctor will save us from the witch doctors. Sometimes I wonder which doctor will save us from the witch doctors. And that's why I appreciate days like this and the document that are going to be launched. Thank you so much.
Let's give him a better clap than that. He really brings it home what people perceive mental illness to be, doesn't he? With his spoken word, we've had those whispers amongst ourselves. Even sometimes we are the ones who are whispering those things. We need to change the narrative. We need to start the conversation. Please remember to go to your social media spaces and let people know what is happening, that they need to start the conversation on suicide prevention, to reduce the stigma on mental health, and to treat people who are mentally ill with dignity. At this point, we all understand the role that the civil society has to play in ensuring that there is access to health care and to mental health services to people, even at family level and community level. And at this juncture, I would like to welcome one of our partners from the civil society, Matthew Mutiso, to just make some few remarks. Tuendelee kupiga makofi mpaka people who are mentally healthy. Today is a good day. So for our mental well-being, karibu sana Matthew.
Thank you so much. Good morning. All protocols observed. I work for an organization called the Coalition Action for Preventive Mental Health. We bring together mental health organizations, basically CBOs and NGOs across the country. Right now, we have about 120 organizations in the coalition. Let me start by saying, I'm sure all of us know about the SDGs, right? There are about 17 SDGs. Our core advocacy area is to mainstream mental health into the SDGs. Let's start, for example, on nutrition. Is there a relationship between mental health and nutrition? Yes? Is there a relationship between mental health and gender? Is there a relationship between mental health and the environment? Let's say floods. Is there a relationship between mental health and justice? SDG 16. Is there a relationship between mental health and infrastructure? We call it matatu madness. You've ever heard of that? Is there a relationship in infrastructure and mental health? Is there a relationship between governance and mental health? Yes? So, we believe that that is one of the lowest hanging fruits that we can have our conversations around mental health. And one of the challenges that we face, even having these conversations at county level, has to do with budgeting. You realize that most of the counties don't even have a budget line for mental health because of how perhaps mental health is seen, how it's highly stigmatized, and now it has been discriminatory for quite a long time. So as you live here, being a World Suicide Day, Preventive Day, we wish you to go home with that understanding that there are very many aspects that we can look at and see mental health. When the statistics say that 1 out of 4 persons, I'm sure if you start counting 1 out of 4, you realize you're so close to these issues because they start from the household level. There are issues of grief, death, either a parent or a sibling. Those are mental health manifestations. But if we start dealing with them at that level, then we'll also avoid them becoming serious ailments. And let me stop at that for the interest of time, and we hope you're going to continue the conversation. Thank you so much.
Him or her, have we started the conversation? How is this conversation going? All right. I can see a few conversations happening. Yes, don't be afraid to speak about your mental health, because it is part of your overall well-being. And we want to welcome another youthful person who is willing to share their story with us. You know, a few weeks ago, we had a lot of interaction with the youth, and they changed the narrative of this country to some extent. The youth are not afraid to speak up. The youth are not afraid to speak about their mental health. And if we continue having this conversation openly, then we'll have a difference. And I want to welcome Ms. Mercy Mudoni to also come and talk to us about her journey.
All protocols observed. Good morning. My name is Mercy Jihia, and I'd like to share with you my journey today from struggling with mental health challenges to advocacy. I'm a mental health advocate. So as I was thinking of what I'm going to share today, I was looking for a quote that could summarize my journey, and I came across this quote by Julieta Lewis, and she says, "The bravest thing I ever did was continue my life when I wanted to die." So my starting point was at early childhood. In our neighborhood, we have a special school, and I kept asking my mom, why do we have children that go to special schools while the rest of us go to these other schools? And she would tell me that those children have a special condition, and that's why they have to exist in a special school. Little did I know that this curiosity would lead me to my passion today, which is advocating for mental health. Before I could get the help I received, I encountered a detour where I had to go through so many practitioners, which are psychiatrists and psychologists, but I'm grateful that finally I got the help I needed. So I also have this other quote by one of my favorite musicians, just called Demi Lovato, and she says, "You don't have to struggle in silence, you can be unsilent. You can live well with a mental health condition as long as you open up to somebody about it." And I encourage all of us today here, because I know apart from patients, even practitioners go through their fair share of problems, and it's okay to talk about it. So I've turned my pain into a purpose through advocacy, and I keep talking to my friends and posting on my status about mental health conditions. So according to the World Health Organization, mental health is a significant concern in Kenya, and approximately 1 out of 4 persons who seek healthcare in Kenya have a mental health condition, including us, the Gen Zs. My message to you this morning is a call to all medics who work with me and others. I want to thank you for the work you're doing, but also remember that some of us are very, very vulnerable, so please be kind to us. I want to encourage the Ministry of Health and youth affairs to empower youth-friendly health services, especially in public hospitals where most of us go to receive the services. Thank you.
Thank you very much. Let's appreciate all those who have spoken. I want to recognize that in the room we have quite a number of persons representing various organizations, from government, ministries and agencies, county representatives, development partners, service providers, private sector, NGOs, academia, research, civil society organizations, users and caregivers of psychiatry services, various hospitals. We really appreciate all of you for coming. We also have the media with us. And if you have not mentioned you, please know that we appreciate you for being here with us. And at this juncture, I'd like to welcome Senator Hamida. Just a minute, let me consult 1 minute. Thank you for your patience. I was consulting my senior. I want to welcome the representative of CDC. He'll also be representing PEPFAR, Dr. Ibrahim Kaptana, to make his remarks. Karibu Daktari.
Yes, distinguished guests, ladies and gentlemen, good morning. Good morning. All right, I'm pleased to be here this morning to really celebrate this Suicide Prevention Day and also the achievement that the ministry has made with stakeholders. But before I start, I wanted to ask in the room if any of us has interacted with someone who has experienced mental health illness. Let me see by show of hands. Okay, let me also see by show of hands if that person received what in your assessment was optimal care and support from the health system and also from the community. Let me just see. All right, so we've gone from over 90% to less than 5%. Today, as I was reflecting on what, to share this morning, I remember the story of a man named Musioka. Musioka was actually my neighbor in the village. I've grown up in Ukambani, and he had unusual behavior in terms of believing that he was a high court judge. And he had episodes where he would be extremely active and episodes where he'd be extremely withdrawn. And having come from this kind of community setting, everyone believed that he had actually been bewitched by his own auntie. And so he spent most of his young adulthood, really visiting witch doctors for treatment. And it was only later that, someone managed to get him to Madari Mental Hospital, where he got hospitalized, and this became cyclic. So he'd get treatment, he'd stabilize, he'd go home, and a year later he'd actually be back. And so as I was reflecting, I realized that the system we are coming from is actually very suboptimal, both at the community and also at the health facilities, because previously we managed mental health illnesses more from a curative and stabilization point, without setting up the preventive and also the community social support. We know that, as I've seen here, mental health illness touch all of us. We know people who have been through this. We've experienced moments where we've been extremely low. And so I'm going to mention 5 numbers and talk about why this is an exciting opportunity for us. We know globally that half of the population will experience mental health illness at some point in our lives. That is a big number, and actually mental health illness is the leading cause of disability in our lives. The second number is 2/3. We know that 2/3 of people with mental health needs do not receive appropriate care. And this varies depending on where you grew up or where you live, because in some places it can actually be very extreme. The third number is 40%. And we know that people with mental health illness, especially the ones with severe mental health illness, have a 40% higher risk of other physical conditions such as cardiovascular diseases and metabolic complications. So it's not just the mental part, but there is associated physical health. The fourth number is 10 to 20. People with severe mental illness tend to die 10 to 20 years earlier than those without. So it is something that does affect our livelihoods. And my final number is 20. And 20 is the estimated number of countries that to date still criminalized attempted suicide. I don't want to talk about Kenya, I'll leave that for Mercy, but I want to appreciate the Ministry of Health for the effort they have made, especially developing the suicide prevention guidelines and really bringing us here today to celebrate, this special milestone. The US government has been a very keen partner. We've been very honored to work with the Ministry of Health and stakeholders in this space, especially after the very successful launch of the investment case that showed that investing in mental health does pay dividends. And actually it was through that we actually looked at our data and realized that even for us, because PEPFAR is mainly focused on HIV, we realized for us to succeed in the HIV program, we actually need to address the mental health needs. Because the things that we struggle with around adherence, around HIV acquisition, a lot of that can be tied to mental health needs. And so we were privileged to partner with the ministry to support the launch of the workplace wellness guidelines, the suicide prevention strategy. And now today we are excited because as we heard from our beneficiary, this will actually move us to the next level where people will have access to high quality comprehensive care that they need. And this is by empowering the health workers. So I wanted just to assure you that as PEPFAR, we are very committed to taking this forward. I think as soon as we have the launch, we'll actually have an internal discussion to look at how we can quickly roll this out by training our implementing partners, the counties that we support, and making sure that this is cascaded to the health providers at the facility and even at the primary level. Because we believe if we empower everyone, then we are going to benefit all of us. I specifically wanted to appreciate the mental health division, Dr. Mercy and your team. I wanted to say, they are one team that has been extremely impressive. And they remind me of the Bible, Luke chapter 19, verse 17. When you're faithful with something that is small, that means when you're entrusted with bigger things, then you can do wonders and rule. And I wanted to appreciate them because the resources that we provided were extremely, modest. But looking at what they were able to achieve, that has been an inspiration. And going beyond that and acknowledging that, we need partnerships, they were able to reach out to Johnson & Johnson and other partners to really, make this a successful initiative. So I wanted to appreciate the partners as well, because we've not been in this together, but it's something that has benefited from all of us and will benefit all of us. As I finish, I just wanted to finish with a call to action for all of us, that we commit to be the catalysts, for change, to speak up, to provide the support, and stand up for mental health in this country. Together we can break the silence and start the conversation today. And when we do so, it will be for the benefit of everyone, where everyone, including ourselves, will actually live in an environment that they feel seen, appreciated, and supported, and by so doing, will create a healthier country and a healthier world. Thank you very much.
Thank you so much, Dr. Katana, for those kind remarks and words of wisdom, and bringing us to the knowledge of how the situation actually is and why we must all take action now. We appreciate the support that we have received from USG and all the other partners, and we are really up to the task to even do more to make sure that Kenyans get mental health wellness and awareness, and they stay healthy. Because there is no health without mental health. Turn to your neighbor again. Turn to your neighbor. Tell them, no health without mental health. No health without mental health. There is no health without mental health. No health without mental health. Now turn to the other neighbor who you are avoiding and tell them it is okay to be or not to be okay. Maybe that's why they are looking the other side, so that you don't judge them. Tell them it is okay not to be okay. It is okay not to be okay. You see, we're already having the conversation. So let's continue with the conversation. And I can see one man in this room who is very happy with the launch of these guidelines, because partly it's going to take a weight off their shoulders. And at this point, I want to welcome the CEO of Mathare National Teaching and PEPFAR Hospital, who has for many years borne the brunt of carrying the load of mental health service provision in this country. And now with the integration of mental health care to the primary health care level, perhaps it will be one of the biggest beneficiaries of this program. Dr. Julius Ogeto.
Thank you, Dr. Massey. Distinguished guests, ladies and gentlemen, good morning. Good morning. Good morning once more. Good morning. I think Dr. Massey, you read my mind, and indeed I want to say that as the CEO of Mathare National Teaching and PEPFAR Hospital, I'm more than excited during this launch of the guidelines we are doing today. The reason being that in the space of mental health in the country, we have got a serious unmet need. We've got unmet need in terms of health workforce. I appreciate the fact that the government has worked very hard to improve the number of health workers in the country. But still the gap in terms of the health workforce is quite big. And indeed, there are several counties in the country without a single mental health worker at this age. Secondly, there is unmet need in terms of access to health products and technologies. In many places of this country, we are still using those good medicines we used in the 1970s. The current treatment methods are not available, both medicines and the therapy services. We still have a big gap, an unmet need in the aspect of mental health care financing. If you look at the total health budget, both in private and in public, the amount of finances that go to mental health care is dismal. This leads to serious gaps in terms of the health workforce and access. And it means that the people who do not have enough disposable income to spend on health care, they cannot access mental health services from out-of-pocket expenditure. When we look at the facilities that offer mental health services, both in government and in the non-state facilities, they are very few. Our government has Mathare National Teaching and PEPFAR Hospital and 14 other units, and a few other areas where you can access mental health services. When you go to private hospitals, including the big ones, very few of them are offering meaningful mental health care services. In terms of research, we got a lot of research in public health, but there is very little research going on into mental health services in the country. Which means that there is very little research informing policy and strategy within the mental health space. In terms of data collection and processing, until recently, the data we captured into the DHIS was very dismal and could not help us make meaningful decisions. Now, with the launch of the treatment guidelines for common mental health disorders, this is going to accelerate the change for the better. The gap of health workforce is going to be addressed by capacity building of the current health workers that we have, especially at the front line, the primary health workers, to have knowledge. It may not be so much, but enough knowledge to recognize a mental health disorder. To be able to know that this patient needs referral to a competent person for diagnosis and treatment. This is really important for us. And it has a multiplier effect because we will be able to diagnose our patients early and access them care early. We will be able to capture the mental health disease burden more accurately, and this will inform policy and strategy in terms of taking affirmative action to train, recruit, and retain more health workers where the people are in the counties, and also to inform budget appropriation specifically targeting mental health workers, mental health patients, and also to inform the budget we are going to appropriate for procurement of the medicines for mental health workers and many other more. This, in effect, will improve access and the quality of care to people suffering from mental illness. With this, the launch of these guidelines, definitely we are going to have standardized data capture and processing to inform policy and strategy. With the launch of these guidelines, and I believe we are going to roll them out and train the frontline health workers to be able to recognize and manage the common mental health disorders, there is one aspect as Mandari we have been missing. We get a patient, we treat the patient so well, and literally recovers from the perspective of the public. When he goes back home in the counties, he relapses because there is one important ingredient we miss: continuity of care. So with this training, we are going to have improved continuity of care when we start the treatment and give this management protocol. The people at the counties and at the lower facilities will be able to continue to manage this patient better, and therefore our relapse rates will be lower. And most importantly, that my previous speakers have spoken to, but in a milder form, with improved access, which is going to come out of implementing these guidelines, with improved access, we are going to have a significant impact in reducing the stigma that is bedeviling the mental health disorders. One of the reasons we have this high level of stigmatization is because we don't have access. So people are left to their own way of interpreting what mental disorder is, and sometimes it is seen more of as a weakness or as a curse or something else other than a disease like any other, leading to poor health-seeking behavior and worsening of our patients. These guidelines will also speak to improved training because of standardization, both in pre-service training and in post-ESC training. It will be improved by having simple, clear, evidence-based guidelines. So the sum total of it will be improving access to mental health care, improving the quality of care, and at the end, contributing to national development. I like what my immediate, the immediate speaker said about the mortality gap. I need to emphasize this. It is important for everybody here to take this home, that between the people who have mental illness and those who do not have mental illness, the people suffering from mental illness die 10 to 20 years earlier. This is a public health scandal that needs to be addressed. We cannot live in the same country and a given segment of people simply die 20 years earlier. Our average life expectancy in Kenya is 67 years. So we are saying that there are Kenyans who will not reach there simply because they have mental illness, and we have got the capacity to treat these people to live as long as the others, and they will die at 47 years. This should not be allowed to continue. And these guidelines for sure will contribute towards reducing this mortality gap. In conclusion, let us remember that the launch of these national guidelines is not merely a formality. It represents hope. Hope to people who have mental illness. Hope to the caregivers who are taking care of people with mental illness. And hope to the mental health workforce. It is a beacon guiding us towards better mental health outcomes for all Kenyans, including reducing the mortality gap that we are having between the people who have mental illness and those who don't have. Including restoring the lives of the people who have mental illness and touching their families and communities. And in Mathare Hospital, we say our business is healing minds, restoring lives, and touching families. Together, we can create a supportive ecosystem where every individual has access to quality mental health care. I urge each and every one of us here today to take ownership of this initiative and work collaboratively towards its success. Thank you.
Thank you so much, Dr. Ogato, for those remarks, and also for saying that now we'll see better health care, mental health care for Kenyans at primary health level, and that Mathare will be willing to support this dissemination of these guidelines to ensure that we continue with quality service. Now, let me ask, how many youths do we have in the house, in the room? If you're a youth, say, "Aru." Well, definition of youth really varies here. But let's even between the age of 15 to 29. Okay, There are none? Nobody between those ages? Raise your hands. Good. If you are a parent of a child who is between, a youth who is between those ages, raise your hand. Okay. If you have a sibling or a relative who is within that age range, raise your hand. Thank you. Did you know that the third leading cause of death of the persons within that age bracket is suicide? Ask your neighbor that. Did you know that? And we all know somebody who is within that age bracket. So that is why we really need to have this conversation going and taking it to the family level, to our dining table, and taking mental health seriously. I'm always happy when I see people who are dedicated to a cause. That is not because it's their primary job that they do, but because of a calling. And amongst us, we have such a person who has, in her own personal capacity, dedicated herself to be an advocate of mental health. I want to welcome to the floor Senator Hamida to also speak to us. She has become a mental health advocate and we really appreciate her. Let's give her a round.
Thank you, Daktari. It's always a pleasure being here. I feel strongly that at times I talk to my people and we speak the language that I understand. Distinguished guests, ladies and gentlemen, first, I really want to thank Mutiso who was here. Mutiso he is a champion and an advocate. He has really pushed me to take mental health to another level. He has really been a good support. Mental health. You know, as the people were discussing, you know, I was just saying mental health starts with us. In fact, the first patients are politicians. And I think you've seen us the way we behave. You'll see us in TikTok doing crazy things. You'll see us, Akiatuko Sawa. We are not. No. And as much as you know, we are looking for, you could be thinking that the mental persons, Wako Madare or any other institution, no, they are here in this room. They are the Senate, they're in Parliament actually. They're everywhere. So seriously, it's a serious issue. And when I realized that I went through that mental breakdown, again, I think I spoke to you last time, is after was it 2022 elections? That one I suffered. And I knew Bas up in Asia. I was speaking to myself. I belong to opposition. I'm nominated by ODM, so as you can imagine what we went through. And I was in the strategy team that I thought, hapa tumeshinda. You saw us tukiimba, yote yawezekana. So imagine you're singing and dancing at Bomas Mejo Meshinda, then bang. You know, let me tell you, for the first 6 months, I didn't want to watch TV. I did not want to speak. I did not understand any language. I was just speaking to, I go to the bathroom, najipata nime stop, you know, sharing and saying, tumelose when? You know, tumelose. So seriously, it was, we suffered. So I feel strongly, these mental cases should start with us. So tafadhali mkituona zile mambo zingine tunafanya huko mwelewe. Shida inaanza na sisi na mtusaidie. We always need support. Please reach out to us, and I've tried to advocate that in Parliament, that we need to have at least a desk for mental health. I will just, I'll do a few remarks. And I want to tell Daktari, CEO, that I promise your remarks, you have articulated them very well, and I promise to take them to another level. It is an honor and privilege to be here today on this significant occasion as we gather for the launch of the National Clinical Guidelines for the Management of Mental Health. Mental health is a subject that is close to my heart and one that requires our collective and urgent attention as a nation. I would like to take this opportunity to express my gratitude to the organizers of this event and to all those who work tirelessly to support the mental health being of our citizens. As we also mark World Suicide Prevention Day, I am reminded to the challenges we face as a country in addressing mental health and how much more needs to be done. The theme for this year, Changing the Narrative on Suicide, resonates deeply with me and the work that I have been doing as a legislator, and it reminds us of the urgent need to reframe how we perceive and address suicide in our communities. In my capacity as a senator, I have had the privilege of moving two critical motions on mental health in the Senate. The motions which have been passed by resolution of the Senate address two areas that are often overlooked but are of profound importance. The mental health of police officers. Our police officers serve on the front line of national security, often exposed to the harsh realities of violence, trauma, and stress. Yet far too long, their mental health has been neglected. In recognizing this, the Senate passed a motion to provide mental health support services to officers. We must ensure that those who protect us are also protected from the invisible scars of mental illness. Number two, promotion of mental health facilities for mothers. The loss of a child is one of the most devastating experiences a mother can endure. For mothers who have experienced stillbirths, the emotional and psychological toll is immense. The Senate resolution calls for specialized mental health support for those mothers, ensuring they receive the care and attention they need during such a heartbreaking time. Those motions represent just a fraction of the work that needs to be done in addressing mental health in Kenya, but they are significant steps in the right direction. We cannot afford to ignore the mental health needs of any segment of our population. It is my brief that mental health should not be a medical issue, but a social and legislative priority. This brings me to an issue that I feel deeply about and one that I can continue to advocate for, the decriminalization of suicide. Suicide in many parts of the world is treated as a criminal act, further stigmatizing those who are already struggling with overwhelming pain and hopelessness. Suicide is not a crime. It is the result of untreated mental illness. As a society, we must shift our perspective and treat it as a public health issue, not a matter of law enforcement. The statistics on suicide are alarming. Every year, we lose thousands of lives to suicide, with many more people attempting it in silence. For every suicide, families are shattered and communities are left grieving. But behind every statistic is a human life. Someone's child, spouse, parent, or a friend. These are lives we could save if we create an environment where people feel safe to seek help. As we launch these clinical guidelines, we are taking a monumental step toward improving mental health care in our country. But let us not stop here. Let us also advocate for policies that remove the barriers to mental health services, increase awareness, and eliminate the stigma associated with a mental illness. Most importantly, let us create a society where those who suffer in silence can find hope, compassion, and support. In closing, I want to emphasize that mental health is in a shared responsibility. Together we can build a Kenya where mental health is prioritized, where every individual can access the care they need, and where no one feels alone in their struggle. I thank you all.
Thank you so much, Senator. We really, really appreciate the advocacy work you're doing at your level to ensure that mental health also is given consideration, even with the laws that we have in our country. And indeed, we look forward that a time like this next year, when we are commemorating World Suicide Prevention Day, we'll proudly say that Kenya is one of the countries that has decriminalized suicide. We really look forward to that. Let's give her another round of applause. Now, one last exercise. Tell your neighbor 135. Whichever neighbor you choose this time. Do you know for every suicide death, about 135 people suffer? It's not just the person who dies by suicide. It's not just the immediate family. It is the people around them. It is the people they work with. It's the people they work with in their day-to-day life. Suicide causes intense suffering to communities and to individuals. If we extend help and provide mental health services to these persons, we will reduce the suffering in the world. So let us start the conversation. Let us be the ones to have the change. We have the power here with the people in this room. And at this juncture, ladies and gentlemen, I want to welcome Dr. Isaac Bashir to take over the next session. Asante.
Thank you, Dr. Masi. Allow me to bring the apologies of our DG, who has been called to an urgent meeting. This is our usual happening in Afri House, and they've just been called by State House. So I'll step in for him so that we conclude this important activity. Allow me to read his speech. Ladies and gentlemen, all dignitaries and all invited guests, good morning. It is with pleasure that I join you this morning as we launch first clinical guidelines for management of common mental disorders in the country, as well as the online WHO Mental Health Gap Action Program, what we call MHGAP, adapted to the Kenyan context. Mental disorders have remained among the top 10 causes of disease burden worldwide, with no evidence of global reduction since 1990. In Kenya, evidence shows a staggering 42% of individuals seeking care in primary healthcare facilities have symptoms of severe depression, with an estimated national prevalence of common mental disorders such as depression or anxiety at about 10.3%. This is as per Professor Dede, 2021. At county level, a study done in Nandi County found close to half of the population was living with at least one mental condition, disorder in their lifetime, with rates highest from depression and anxiety. This is as per Kiwoba in 2017. Despite the high burden of mental disorders in the country, there is low rates of mental health literacy among primary healthcare workers with routine diagnosis of psychiatric mobility remaining poor, thus resulting in most mental disorders being undiagnosed. This further widens the treatment gap for mental disorders, which is estimated by the Task Force on Mental Health to be about 75%. To address this issue, the task force recommended capacity building initiatives for healthcare workers to improve the availability of mental health service across the country. Ladies and gentlemen, it's against this backdrop that the Ministry of Health set out to develop the first national clinical guidelines for the management of common mental disorders in Kenya, which is further augmented by the online mental health gap action program. These guidelines and the e-training aim to improve the identification and treatment of mental disorders within primary healthcare settings. Furthermore, these guidelines have been designed to enable use by various categories of healthcare workers without specialized psychiatric training. This is in line with our vision of strengthening primary healthcare to enable the achievement of universal health coverage and the government's bottom-up economic transformation agenda better. The guidelines focus on the most prevalent mental disorders based on the national trends. Additionally, a systematic approach has been undertaken across the document, covering diagnostic modalities, recommended management or treatment modalities that include psychosocial and pharmacological interventions, indications for referral, special considerations for managing specific populations, such as the prenatal mental health, older persons, and persons with co-occurring physical comorbidities. Guidance on multidisciplinary approach to clinical decision-making for comprehensive patient care. Ladies and gentlemen, the launch of these important clinical guidelines and the mental health e-training comes on the day we are observing the World Suicide Prevention Day, whose theme this year is changing the narrative of suicide, with a call to action to start the conversation. At an individual level, this theme urges us to engage in open discussions about suicide, aiming to reduce stigma and encouraging people to seek help. It also underscores the need to prioritize suicide prevention and mental health in policy making, advocating for government action. Changing the narrative requires us to champion policies that prioritize mental health, enhance access to care, and offer support to those in need. Studies have shown individuals at risk of suicide often make increased visits to healthcare facilities in the weeks preceding their death. These visits present critical opportunities for intervention. Therefore, we intend to disseminate these clinical guidelines and build the capacity of primary healthcare workers to improve access to early detection, treatment, and support services for Kenyans experiencing mental health problems. This will in turn reduce the suicide mortality rate in the country. We solemnly remember the lives lost to suicide and honor their memories by reaffirming our commitment to suicide prevention and support. Our conditional love and care to those struggling with suicidal thoughts, reminding them that hope exists and help is always within reach. Finally, ladies and gentlemen, the development of these guidelines for the management of common mental disorders and the adopted WHO-MHGAP e-training program was a collaborative effort involving a wide range of stakeholders from various service delivery sectors. We appreciate the development partners, including PEPFAR, CDC, and Johnson & Johnson, for making this vision a reality. We now embark on the important journey of building the capacity of the healthcare workers to deliver high-quality, evidence-based mental health services at primary healthcare level. We therefore call upon our partners both in the public and private sectors, to join us in implementing this noble cause. Together, we can actualize our vision for mental health in Kenya, a nation where mental health is valued and promoted. Mental disorders are prevented, and persons affected by mental disorders are treated without stigmatization and discrimination, with a goal to attain the highest standards of mental health. It is now my honor and pleasure to officially launch the clinical guidelines for the officially launched. I think I'll be joined by our dignitaries so that we can do it on stage in style.
Allow me to call the dignitaries that will be joining Dr. Bashir in the launch. CEO Madari, Dr. Ogato, CDC representative, Dr. Abraham Katana, Africa CDC representative, Dr. Lucy Kazianga, J&J representative Ida, Senator Hamida, and USID representative, Dr. Teresa. Kindly come to the podium as we do the honors. And our team from the Division of Mental Health will be helping in cutting the ribbon. We're also encouraging you to all have your phones ready, because you're also going to be revealing a code which you'll be able to scan to access the online e-learning platform on the WHO MHGAP. Thank you.
Service users, caregivers,
Alpha. Where?
We also start the QR code for the mental health training.
for coming today. I want to give special thanks to Senator Hamida Kibwana before she leaves. We appreciate that she came for this launch, and this is a great milestone for the country, and we appreciate you making time for this. We also want to thank the Ministry of Health leadership led by our CS, our PS, and our Director General of Health. We also want to thank the Director for Family Health, Dr. Bashir, and the Director for Mental Health, where we started the process with Dr. Simon Chukuna and now the incumbent, Dr. Mercy Karanja. We also want to give special thanks to the technical working group which spearheaded this process. This took some time. Also the county representatives, we had representation from all the regional blocks in the country. We also want to thank all the national referral hospitals, service providers, private sector, public sector, our NGOs who we work with, CSOs, media houses for being here today, service user organizations, and finally our developmental partners. Special thanks to PEPFAR, CDC, Johnson & Johnson. We would not be here today without you, so we really appreciate it. Africa CDC as well. So thank you all, and lunch will be served at 12. Asanteni sana. Please scan the QR code. Our mental health e-training is live, so we can scan and see how the course is. Thank you so much, and kwaheri. Please wait for lunch. Lunch will be served here. You don't have to leave the hall.
Infatti,